This podcast episode is based on the book Eminence, The New Standard for Plastic Surgery Marketing by Jen Ahlsten, published by Vitruviani in 2026. Chapter 1: How Patients Find and Judge Plastic Surgeons. Many prospective patients arrive at the consultation having already formed an opinion about the surgeon. Before making contact, they evaluate photographs, reviews, social media profiles, and the quality of the practice's online presence, using these cues to judge whether the surgeon appears trustworthy. The pre-consultation decision. For many prospective patients, the search for a plastic surgeon begins online. Before contacting a practice, they may compare websites, browse before and after galleries, read reviews, and watch educational videos. As they move through this process, they register cues that once carried little weight in clinical contexts. The presence and quality of a practice's social media presence, the tone of its written communication, and the way critical reviews are handled. Many surgeons assume that credentials are the most obvious qualifier when patients compare providers. Technically, board certification remains one of the strongest objective indicators of specialized training available to patients, but research suggests that many patients do not fully understand what the credential means or how it differs from other professional titles. The evidence suggests that instead of scrutinizing credentials, patients often prioritize other signals when choosing a provider. A 2023 qualitative study of aesthetic surgery patients indicated that patients rely on subjective factors when choosing whom to trust. Study participants consistently emphasized bedside manner, prior patient satisfaction, and institutional reputation as important factors when choosing a provider, while most assigned relatively low importance to board certification. In the same study, none of the participants knew that any licensed physician can legally offer aesthetic surgery. Many assumed that visible professionalism, institutional affiliation, or the title cosmetic surgeon reflected a significant level of specialist training. This implies that being a board-certified plastic surgeon doesn't always speak for itself. Online visibility and presentation influence which practices get noticed and trusted by patients. 4 assumptions that cost practices patients. Before examining how patients actually make decisions, we first need to examine the assumptions many surgeons have about digital marketing. Many of these beliefs reflect how client acquisition in the plastic surgery industry used to work in the past, and most of them were accurate when the clinic's online appearance mattered less. First, most surgeons still assume that clinical excellence will be recognized on its own. While that would be ideal, the challenge is that patients cannot directly evaluate surgical skill before treatment and rely on other signs of trustworthiness instead. These include result photography, the quality of the practice's marketing materials, the tone of its communication, and whether the surgeon's personality and taste feel aligned with their own. As a result, strong surgical work can be overlooked when the surrounding presentation is unintentional or inconsistent. Another assumption is that digital marketing is separate from clinical reputation and patient experience. As a result, the clinic might appear different on the practice website in comparison to its social media profiles and patient communications. The problem is that patients do not see these materials as separate from the practice. They experience them as cumulative evidence of the practice's judgment and standards. When the presentation is inconsistent, the practice itself can begin to feel less trustworthy. A third assumption is that trust begins in the consultation. In reality, trust often starts forming during the research phase, often weeks or months before a patient contacts the practice for the first time. A patient who arrives already confident, compared to a patient who arrives somewhat uncertain, will interpret the same consultation differently, even when the surgeon's performance is identical. A consultation may deepen trust and build rapport, but it usually needs to build on trust that started forming when the patient was comparing providers online. Finally, many surgeons rely on outsourcing the practice's public image to a marketing team. In reality, marketing tasks can be delegated effectively only when a brand strategy has been put in place. A surgeon certainly does not need to write their own captions, edit videos, or design a website layout. But they do need to be aware of the underlying principles guiding how the practice is presented across patient-facing media. Social media and advertising teams can execute the planning and creation of the content, but they need a clear standard to follow, instead of merely attempting to reach visibility and conversion goals. Brand strategy often sits outside the skill set of in-house marketing teams, which is why many practices benefit from investing in brand strategy that then guides every decision the members of the marketing team make, resulting in more efficient campaigns and content production. The referral as a starting point. Few credibility signals are stronger than a patient who personally recommends the practice. The reliability of a friend's personal, unsolicited recommendation is something no advertisement has managed to replicate. Referrals remain important, but their influence has changed. Online reviews now function as part of referral verification. In a commercial 2025 survey of 1,008 US adults, 84% of patients reported checking online reviews before choosing a new healthcare provider, and 61% stated that negative online reviews would override personal recommendations. The way patients compare providers is changing. Traditional search engines have long been a major entry point for online provider research. AI-assisted search is growing quickly. Recent commercial survey data suggests AI-assisted search is becoming part of how some consumers gather information online. This shift requires plastic surgeons to ensure their practices appear in AI queries. If the surgeon is absent from AI-generated answers, the practice may be less likely to appear among the options the patient initially considers. When a patient asks an AI which surgeon to consult for a rhinoplasty, they receive a recommendation assembled from indexed practice content, third-party sources, local listings, reviews, and other available web references. Practices with negligible digital content and few credible third-party references may be harder for search and AI systems to characterize clearly. Chapter 12 will explain in detail how practices can structure a digital presence that is competitive in AI-mediated search. Eminence is available on Amazon and at Vitruviani.com. Next, Chapter 2, the patient's first impression.